Breastfeeding is a natural process, but it can come with challenges. Here are some common breastfeeding problems and solutions. Number 1. Sore or cracked nipples. This is a common issue, especially during the early weeks of breastfeeding. It can occur due to incorrect latch, thrush, or friction. Solution: ensure the baby is latching properly. A shallow latch can cause nipple pain. Try nipple creams or coconut oil to soothe and protect sore nipples. Number 2. Engorgement. Engorgement happens when the breasts become overly full of milk, making them swollen, firm, and pain. Solution: nurse frequently or pump to relieve the pressure. Apply warm compresses before nursing and cold compresses afterward to reduce swelling. Massage the breasts gently while breastfeeding to help the milk flow. Number 3. Low milk supply. Some mothers may experience a low milk supply, which can be caused by stress, not nursing enough, or hormonal imbalances. Solution: ensure the baby is nursing frequently, at least 8-12 times a day. Stay hydrated and eat a balanced diet. Consider power pumping, pumping for 10 minutes every hour for several hours, to increase milk production. Number 4. Cluster feeding. Babies may feed more frequently during growth spurts, which can be exhausting for mothers. Solution: be patient, as cluster feeding is a normal part of infant growth. Take breaks, eat well, and hydrate to maintain your energy. Number 5. Nipple confusion. Some babies may get confused between the breast and bottle nipple, which can lead to difficulties in breastfeeding. Solution: if bottle feeding is necessary, wait until breastfeeding is well established. Use a slow flow nipple if bottle feeding, which mimics breastfeeding more closely. Number 6. Blocked milk ducts. Blocked ducts occur when milk gets stuck in a duct, causing a tender lump and sometimes swelling or redness. Solution: apply warm compresses to the affected area. Massage the area gently during feeding or pumping. Ensure the baby is feeding from all areas of the breast to prevent milk buildup. Number 7. Thrush. Thrush can cause pain, redness, or white patches on the nipples and inside the baby's mouth. Solutions: sterilize bottles, pacifiers, and breast pumps to avoid reinfection. Ensure proper hygiene, including washing hands before breastfeeding. Number 8. Baby not latching properly. Poor latch can cause discomfort for the mother and may lead to inadequate milk transfer for the baby. Solution: make sure the baby is positioned correctly with their mouth wide open. Keep trying different positions for breastfeeding to find one that works best for both you and your baby. Number 9. Leaking breasts. Leaking breasts can happen between feedings when milk production is high. Solution: use breast pads to absorb leaks. Wear a well-fitting bra to provide support. Express a little milk before breastfeeding to relieve pressure. Number 10. Mastitis. Mastitis is an infection of the breast tissue, causing pain, redness, and flu-like symptoms. Solution: continue breastfeeding or pumping to clear the infection. Apply warm compresses to the affected area. Rest and hydrate well to help with recovery. Thank you so much for watching. I hope you found these tips helpful. If you did, please give this video a thumbs up and share it with others. Don't forget to subscribe to the channel and hit the notification bell.